Hello and welcome. Today you will be having a eyes closed cranial nerve exam. Have you ever done one of those exams before? Okay, well, just sit back and relax. I will guide you through it. They're very straightforward, okay? Before we begin, I do have some pretty standard questions that I need to ask you, okay? Alright. Are you in a comfortable position? Okay, good. You can begin by just closing your eyes. Be sure to close your eyes very gently. Don't aggressively have them closed. Very gently, as if you were going to sleep, okay? Alright, great. Can I get your name? Just double checking, it's the one we have on file. Okay, can I get your date of birth? Once again, just double checking. Can I get the names of any medication you are currently taking or have taken in the past 6 months, even if you're not currently taking them? Okay. Is there a specific reason why you have come in today to get this exam done? Okay. Do you have any diagnosed mental health disorders? Do you use any mobility aids? Okay. So, for today's exam, I will be testing your sense of sight, touch, sound, taste, smell, and temperature. We don't typically test temperature, but because this is an eyes closed exam, we do add the additional sense. Okay? Great. So, let's begin. First, I'm going to remind you to keep your eyes closed, okay? Yep, very gently. Good. So, with that being said, I will be testing your vision. So, there will be a bright light that will be going across your eyes. I want you to tell me when you see the bright light, okay? Ready? Remember, keep those eyes gently closed. Good. 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 Great. Good job. Great. Good job. Good job. Good job. Good job. Fantastic. Great. Now, I want you to indicate to me which side of your face you see the light better. So, that might just mean which of your eyes or eyelids sees the light better, okay? Focus as well as you can, okay? Good. Great. Fantastic. Great. Great. Good. Very well done. So, that is sight entirely done. Yep. We don't do any reading or any other vision tests because your eyes are closed, and it's a bit hard to do vision tests when your eyes are closed. Okay. Great. So, now, just going to make a quick note of how you did. Okay, and now let's do sound. I have 2 bottles here. One bottle that is filled with liquid, and another bottle that is completely empty. I want you to tell me the difference between the tapping on the empty bottle versus the tapping on the full bottle. Tell me which is which, okay? Let's begin. That was the empty bottle. That was the full bottle. Can you hear a difference? Okay, now let's try it this time. I won't help you. Alright, let's go. Good. Great. 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 Good. So now I'm going to use these very same bottles and spray them. You're going to tell solely on sound which is the empty bottle, and once again, which is the full bottle, okay? So, here's your example. I have to get this one to work real quick. Okay, this is the full bottle, and this is the empty bottle. Tell me which is which, okay? Full. Empty. Full. Full. Empty. Full. Empty. Full. Empty. Full. Full. Empty. Empty. Very good. Was that hard or easy for you? 10 being very difficult, 1 being not difficult at all. Okay. Alright. That does make sense. Okay. Now, I'm going to whisper some words in your ear, and I want you to repeat back what I'm saying, okay? Coconut. I'll repeat it again. Coconut. Good. Let me give you another one. Tie-dye. I'll repeat it again. Tie-dye. Good. Another one. Camera. Camera. Good. Let me give you another one. Mirror. Mirror. Good. Alpha. Alpha. Very good. One last one. I have to think of words on the spot every time. It's very fun Easy or hard? Okay, once again, 1 to 10. Okay. Very good. Now, I want you to tell me where you think the sound is coming from, okay? So I'm going to click my pen and tell me where, so you can indicate with your hand, okay? Good. 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 Great. Very good. Okay, I'm just pushing your hair back for just a moment. There we go. Alright, let's continue the test. Good. 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 Great. Very good. Next is touch. I want you to tell me which glove is touching you. I have this latex glove. You're not allergic to latex, right? Okay. I have this latex glove and this exfoliation glove. Now, the exfoliation glove is a bit more rough, right? And the latex glove is a bit more soft, okay? So, indicate this exfoliation glove being glove A and the soft latex glove being glove B. Okay, so rough A, soft B. Okay, great. So let's begin. Tell me which one you hear or feel. Okay, good. 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 Great. Can you give me your arms really quick? I'm going to do the same test on your arm. Good. Okay, good. Now on your shoulder. Okay. Your face again. Okay. Okay, very good on that exam. Now, I need you to tell me where I am touching you on your face. I have this tool that's typically used to feel out your knee, but instead, I'm just going to place it on various parts in your face, okay? And you're going to have to tell me where you feel it, okay? Cheek, good. Other cheek, good. Forehead, good. Nose, good. Chin, good. Eyelid, good. Other eyelid, good. Now I'm going to move to other parts of your body, mainly your shoulders and arms, so indicate as such. Shoulder, good. Arm, great. Arm, great. Shoulder, good. Ear, very good. Alright. That was simple enough, I think. Now, I have a sharp object and a dull object. I want you to tell me which is which, okay? Sharp or dull? This is sharp, and this is dull. Okay, keep that in mind, okay? Sharp and dull. Ready? Let's begin. That was dull. That was dull. That was dull. That was sharp. That was sharp. Sharp. Dull. 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 Sharp. 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 Dull. Dull. Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Very good. Alright. Yeah, that one's a bit of an easier test for people. Now, let's test your sense of smell, okay? So, do you mind if I borrow your hand really quick? Great. Just going to grab your hand. I have this rollerball perfume, and I want you to tell me what it smells like, okay? Okay, now smell it. What do you think it smells like? If you were to qualify it as a more masculine or feminine scent, what would you pick? Feminine scents are typically more flowery. Typically, of course, not always. And masculine scents are a bit more woodsy, as per the perfume industry. Okay, very good. It was that one, correct. Now, just going to make a few quick notes regarding the past tests and how well you did. Touch. Yeah, you did pretty well on the touch, I think. And then the smell, you did really well. The smell one, that was easy enough. Now all we have left is taste and temperature. Okay, so now all we have left are taste and temperature. Okay, so can you just stick out your tongue for me? Okay, great. Just using this tongue scraper to make sure you have no other tastes on your tongue. Alright, now I'm going to put some of this cream right on your tongue. This will heighten your sense of taste just for a short moment to make this test a bit more accurate, okay? Yeah, we do anticipate you maybe have eaten something or smelled something from the last exam, so this just makes it a bit less confusing for you and me, okay? Okay, great. So now, very good. And now are you fine with candy? Okay, well, I have a bag of these flavored sour gummy worms. Or I guess they're called candy grass. And I want you to tell me which flavor it is, okay? Close your eyes. And, well, hopefully they've been closed. And what does that taste like? Blueberry, good. I had one too. Very good. Okay. Taste. All done. Now, our last exam is temperature. This one is super quick. This light has some heat to it, and this perfume doesn't. Tell me which is the light, okay? The first one was the light. Very good. So, your exam is all done. You passed with flying colors. Thank you so much for stopping by, and let me know if you ever need a cranial nerve exam done again with your